COVID-19 vaccines, they're moving toward their final phase of trials now. If a vaccine were publicly ready by winter, where might kids fall on the priority list of getting this?
It's a really good question, and you could imagine that people making these decisions are going to have some really difficult decisions ahead of them. It seems most likely, though, that the first priority for a limited vaccine supply would probably go to healthcare workers, other workers that are considered essential, and first responders. And then additionally, the people who would be considered the most vulnerable to severe infection would likely be the next group to reasonably prioritize for immunization. There will be some guidance from groups like the CDC around how to prioritize these vaccines, but ultimately the decisions will be up to local and state health departments. So when they're making those decisions and thinking about where children would fall in the priority list, you could argue that children don't get as sick in general from COVID-19, so maybe they wouldn't be as high on the priority list if vaccine is limited. But then it may be that children contribute to community transmission significantly, so therefore that would be reason to prioritize them. It may also be that by the time these decisions are being made, we may have more data available about the role of children in transmission because schools may have reopened either here or in other parts of the world by then. So we may have a little bit better data to really inform those decisions by then.
It's all important and really reminds us that the situation really is so fluid. So let's talk about what's happening now. More kids returning back to sports practice this week, and we know some programs are requiring the masks. They can get hot and sweaty though pretty quick. We have seen some ads for sports masks that allow more airflow, but our question is, isn't that the mask is supposed to limit airflow, right?
That's exactly right. So it's a really good question. I'm not totally sure what's always meant by sports masks. I have seen, though, some advertisements for masks that at least state that they offer better airflow and are therefore advertised as sports masks. They seem to usually involve these valves that might facilitate airflow and make it easier when you're breathing out or in particular. But I think in general, what families should consider when they're thinking about which mask their kids will be using would be think about what the purpose of the mask is to begin with. It's really meant to serve as a barrier to respiratory droplets that are exhaled. So if you're looking at a mask and it seems like some design in the mask that has been put there to make airflow easier is going to basically take away its functionality, then it probably doesn't make sense as the best idea for a mask to pursue. Cotton masks still are recommended by the CDC, so a comfortable cotton fabric that's a solid piece of fabric that can maybe be layered in two and turned into a mask. And maybe for sports practices where kids know that they're going to be exerting themselves a lot, they could bring an extra mask or two to have one to change into in case one gets really sweaty or wet, and then just wash them in between uses. And that might be the best solution.
All right, good advice, Dr. Moffitt, as always. Thank you so much. Good to see you. Stay well.
Good to see you too.